Welcome to this edition of the First Aid Show. What we're going to do in this video is just have a quick look at what to do when you approach an emergency scene. It may well be that you're watching this and you're not a first aider. So what do we do when you approach somebody and there's an accident? Now, to start with, stop, think and act. Don't just go rushing into a situation. So for example, if someone's been carrying an item and they've fallen over and maybe they've hurt themselves, don't just go rushing straight in, because there may be some chemicals, there may be risks, there may be hazards that could hurt you. So as soon as you're approaching a scene, check that the scene is safe. As you approach the person, if you are a first aider, then great, help the person, but also then get other first aiders in the workplace or bystanders to come and help you. When you're dealing with someone, if there's blood involved or any other bodily fluids, make sure you wear barriers. Get some gloves. You can get hold of these from your workplace first aid kit or from your car or any other source. Activate the emergency medical service if you need to. Make an assessment straight away. If you're worried or there's some serious injury happened, then call the emergency medical services. You can call them from your mobile, from your work phone. But if you are phoning from your work phone, you may need to dial an extra 9 to get an outside line. Now, the sorts of problems you could come up with could be things like a breathing problem. Now, this is probably one of the more serious ones, particularly if they're not breathing. So if this is the case, we may need to go into CPR. But also, when we're activating emergency services, need to make sure that they know this person is not breathing. Now, back to the example with someone carrying a box and falling over. There's two types of injury could happen. They could just simply hurt their spine, or they could have what's defined as a spinal injury within first aid. If something's a spinal injury, we would leave them where they are, we would not move them, and we protect them from harm. Because if we did move them, this could cause them more problems. If they have just, well, maybe crudely called hurt their back, or they've done some injury, this can be extremely painful, but it's not an actual break to the back. This is mainly things like muscles, tendons, ligaments that have been damaged within the body. Other things to look out for will be bleeding. Maybe they've fallen over and then they've hurt themselves and bleed. So get a first aid kit and treat the bleed, or if you're not directly a first aider yourself, go and get help and get someone else to come in and deal with the problem. But the whole time you want to keep them safe, you want to keep talking to them, communicate with them, even if they're unconscious. Good manners and help with someone will reassure them. If they're focusing on answering your questions, they may be less focusing on the pain and any discomfort they're in. If an accident happens in the workplace, then you're going to need to record the accident. You may need to report it to RIDOR or organisations or within your work organisation. And you may need to also ensure that any first aid equipment that you've used has then been topped up.